Hi, I'm Dr. Putnam with Richmond Veterinary Clinic. Today I want to talk about dentistry, the importance of dentistry on a day-to-day basis with our pets, dogs and cats, ferrets alike, that we see every day when we do our physical exams. So often in our physical exams, when we do our annual exam, I do look at the teeth. I look at every tooth in the mouth. We pull the lips back and we look and see the condition of the teeth. Dentistry is very important in the pet's mouth. It's the start of the digestive tract. So if we have a mouth that is really dirty, has a lot of tartar, has a lot of pathology, then we are starting the digestive process already in a negative light. Infection in the mouth, bacteria in the mouth, all of that stuff can have a negative effect on the rest of the body, including the liver, including the heart, including the kidneys. So when we force ourselves to really impress upon people the importance of looking at the teeth, keeping the teeth clean, and starting the digestive tract with a nice, good, healthy mouth. A lot of times I'll get asked, people ask me, oh, what's the process? Do they have to go asleep? Because there are individuals out there that are doing non-sedated dentistry, okay? That to me is a very difficult thing to recommend because you cannot do a complete dentistry with a dog or a cat awake. So yes, when we do our dentistry, we do suggest that they be asleep. We do require that they be asleep. When we're looking in the mouth, we're looking for pathology, infection. We're looking for enamel defects, discoloration in the tooth from a number of different causes, anything from pulpitis, which is from trauma, to color defects from maybe mom had a fever in gestation, and so the pups can have some dental defects there. Young dogs getting tetracycline as an antibiotic can sometimes cause discoloration on the adult teeth as well. So we're looking for all of these kind of defects. We're looking for any pathology, anything that is not normal in the mouth. While they go asleep, what we always do, and I always offer pre-surgical blood work before we go under anesthesia. And that pre-surgical blood work's purpose, what we're looking at is we do a CBC, which is a complete blood count. So we're looking at the white blood cell count, the differential, the 5 kinds of white blood cells we see, how they're distributed, the red blood cell count, and the platelets. The other part of the blood work is a very short organ panel. And what we're looking for is we look at 2 liver values, 2 kidney values, a blood sugar, and a total protein. This information that we gather just ensures us that our patient is as good as we can tell going to be okay when we go under anesthesia. It's just another tool in what we have, information that we gather that says anesthesia is going to be safe. While we prepare our pets for anesthesia, I put an IV catheter in their vein, and a lot of people ask me, say, how do you keep that in? Very simply, they don't really mess with it very much. We place an IV catheter in the cephalic vein, which is on the front leg. And that is for 2 purposes. One, that's how we administer our medication, our sedatives going under anesthesia. Number 2, we do give them fluids while they're asleep. And the purpose of the fluid therapy while they're asleep is to maintain blood pressure. The brain, the kidneys, the heart all require blood pressure in order to work normally. So by administering anesthesia, we will naturally drop that blood pressure just a little bit. By adding fluids, we try to counterbalance that and keep our blood pressure up to maintain good perfusion to the brain, and perfusion I mean blood, good blood perfusion to the brain, to the kidneys, and to the heart, the most important organs that we need to have while we're under anesthesia. So first we do pre-surgical blood work, then we put in an IV catheter for IV fluids during the procedure. Secondly, then, once we get a good exam done, I do an examination on every surgical patient. So after we get the blood work, after we place the IV catheter, I examine the dog, tip of the nose, tip of the tail, make sure everything sounds okay, feels okay, and looks okay. Then we're prepared and we're ready to go under anesthesia. So what we do is we'll go ahead and administer, I use propofol as an anesthetic agent, and it's a sedative agent, and that allows the pet to go asleep enough to where we can intubate, to where I can put a tube in the airway it's called intubation, and we can hook them then up to gas anesthesia, which keeps them asleep throughout the procedure. Then what we'll do is we'll start the procedure. I usually start the procedure with dental x-rays. We x-ray every single tooth that the pet has in their mouth, from right side to left side, from top to bottom. And what we're looking for with dental x-rays is we're looking for pathology under the gum line that we cannot see with the naked eye just by looking at the tooth. The statistically is 42% of pets have subgingival disease that you cannot see with the naked eye, thus the importance of taking x-rays. I x-ray every single pet that we do dentistry on, dog, cat, ferret, it matters not. We x-ray everybody. So then what we do, we determine, is there any pathology in the mouth that needs to be addressed? If there is a tooth that needs to be extracted or needs to have endodontic treatment or periodontic treatment, I usually at that point call the owners, tell them what we find with our oral exam while they're asleep, oral x-rays, and then we proceed from there. If an extraction is needed, then we will go ahead and plan for that extraction. If everything looks good, the gums are healthy, the bone underneath the gums are healthy, the teeth are healthy, then we proceed with our cleaning. We use an ultrasonic scaler to do our cleaning, and what that means is ultrasonic means it vibrates and uses sound waves. And that scaler actually breaks that tartar off. One of the things I tell folks when they say, can I brush tartar off the teeth? And I tell folks you cannot. Tartar on the tooth is like barnacles on a boat. It must be scraped off. So we use a combination of an ultrasonic scaler, which does the biggest majority of our work. We use that scaler and we scale the enamel. We scale every tooth outside and inside, thus the importance of the anesthetic procedures, because we can get in between the teeth and underneath on the inside of the teeth as well. After we get all that, then we use a hand scaler, and the importance of the hand scaler is those tight places in between teeth, the places underneath the gums where you're not comfortable using a vibrating tip to get underneath the gum in fear of damaging the gum. So you use a hand scaler, and we hand scale underneath that gum and try to get any remaining tartar that's there. And we do that on every single tooth. We check for pockets, just like they do for you and I, where we're measuring how many millimeters pockets are all around the tooth, inside and out. Finally, then we'll do a polishing. When you do a scaling, when you do ultrasonic scaling, there are some scratches, superficial scratches that you will put on the enamel. And so the polishing then kind of alleviates those scratches, kind of buffs those scratches out, kind of like you would on your car. Then we rinse and usually apply Nolvadent, which is a chlorhexidine rinse, which is an antibacterial rinse. And at that point then, we're off anesthesia and we wait for the pet to wake up. The pet wakes up, we extubate, which means we take the tube out of the airway and they recover. We run them on fluids pretty much until it's time for them to go home later that afternoon. And that's our dental procedure.